And he's going to give us a report on the Affordable Care Act, Obamacare, and he's going to talk to us about some of the issues with it, what we should be talking to people around the water cooler, or at church, or across over the fence to our neighbors. So please help me welcome Jim Frogue.
Thanks so much. It's great to be back here. It's been, I think, was it 4 years ago about this time?
4 years in August.
Where we talked about exactly this issue and how it was going to get bad and get even worse. So that's where we are now. So in my short amount of time, I just want to walk through a couple of key bullet points for candidates that are out here, those are advising candidates, anyone that's dealing with media, about how to really go after Obamacare, specifically because in the last 2 weeks, they seem to be declaring it a success. Not normal people, but chattering classes, the president himself, his advisors, and others seem to think that it's working just fine now. Well, it's certainly not, and it's going to get worse. In fact, there was a Democrat congressman from Massachusetts, of all places, a Democrat from Massachusetts, who over the weekend said, this is about to get a lot worse. So when Massachusetts Democrats are terrified about what's coming, you can really believe it's going to be a big problem. So first of all, we've all heard 7.1 million, 8 million, whatever the number is. It doesn't really matter because it's not a real number, but you've probably heard these numbers in the press. It is kind of funny how it's the first time in 6 months they actually know the number. You notice that? Back in November, December, they had no idea. January, February, they had no idea. They couldn't give you any information. And then suddenly on April 1st, April Fool's Day, they of course had a number, 7.1 million. Now apparently it's up to 8 million. It's a silly number. It's completely fictional. And just purely from a political reason, if you're telling something that's so false and is so easy to cut off at the knees, you're making it worse for yourself. We've all been little kids and told lies. You just know, once people find out this lie I've been telling for a month or 2 months or whatever, when they find out it's going to be even worse. It should have just been more honest or kept lower expectations all the way along. We don't know for sure, but up to half of these supposed 7, 8 million enrollees were people that were previously insured. People that had their policies canceled because of Obamacare last fall. Between 5 and 6 million people, 5 and 6 million people across the country, you probably know some here in Iowa, that had their policies canceled last year. And a lot of them were people that had I personally have an individual policy. I buy by myself. I just pay $130 a month. Fortunately, it was grandfathered this year, so I don't have to get rid of it just yet. But for a lot of people, they had to get rid of their policies. A lot of young people, a lot of small business owners, a lot of people that may not be working for whatever reason. And about 2 to 3 million of them are new enrollees. So if there's maybe 100 people in this room, and I took away all your insurance, and say 50 of you got new insurance, I could stand here and say, hey, 50 people got insurance under my plan. Well, that's a little dumb, because 100 of you had insurance before I showed up. It would be much better if you just kept what you had. So for them to claim that this is some sort of victory is just crazy. Studies have shown that at least 20% of people have not paid their first month's premium yet. Have not paid at all. So the enrollees, it's like, you've probably heard this, if you go into Amazon.com or if you put something in your cart, that's not a purchase. A purchase is when you actually pay the money. And insurance companies actually don't consider you enrolled until you've paid a first premium. So about 20%, at least 20% of people have not even paid a premium, so they're not even enrolled. So take that $7 or $8 million and times it by 0.8, and you're already heading down fast. Just yesterday, we do a lot of work in Georgia. I worked for Newt Gingrich for a number of years, and my business partner is very close with Governor Deal, who's up for election this year. It looks pretty good, running against Jimmy Carter's grandson. That should be fun. But the Georgia Insurance Commissioner said the other day that over 50%, 50% of people have not paid their first month's premium. 50%. That's even us deep skeptics like me were surprised by 50%. 220,000 applications and only 107,000 have paid. Over 50% have not paid their first month's premium. So 20% is what you're hearing in the media. They concede 20. So if they concede 20, you know it's going to be worse. Now 50 seems like a very high outlier, but the number is between 20 and 50% people just haven't paid. Not to mention the fact people who are not going to pay eventually. It's possible 30 or 40% of people who start paying will stop by the end of the year because premiums are very, very expensive. So even if they are paying initially, made their first month's or second month's payment, does not mean they're going to be paying 6 months from now. So there was a really interesting study that came out about 2 weeks ago. It didn't get nearly the attention it should have, but this just cuts right to the core of why this thing's going to be a failure. The people that bought Obamacare plans, especially initially in January and February, among the early enrollees, there's now finally data about who those people are. Not their names, although you probably get those with all the security flaws on healthcare.gov, but their health status, which is a really important part of insurance pooling, as you know. So they looked at people who, and this is, Express Scripts is a giant company. They manage the pharmacy benefits, and if you have a United or Blue Cross or Aetna or Cigna, whatever plan you might have, Express Scripts probably manages the pharmacy part. So when you go to Walgreens or CVS or you might go to get a prescription filled, they're the ones that actually run that benefit. So they looked at people who had enrolled in January, February, and compared them to people who just had regular health insurance. So just a normal average pool of people versus the new enrollees. The people enrolled in Exchange had 4 times the HIV medications. 4 times. Not 4%, 400% more HIV medications than people who were in just regular health insurance. Pain medications 35% higher, anti-seizure meds 27% higher, antidepressants 14% higher. That's a very bad pool of people buying. Now, a lot of you probably at some point in your life or know someone who exercised a COBRA option. And if you're not familiar with what that is, if you leave an employer for whatever reason, if you're let go or laid off or leave for some reason, you have an option to exercise something called your COBRA rights. It was a bill that a law that passed in the 1990s. And for 18 months, you can keep the health insurance that you have to pay it yourself, but you get to keep it. So most people are at least have heard of this, but you have to pay the full freight. So it's actually very, very expensive. Well, only about 1 out of 5 people exercise their COBRA option. So if you're a younger person or a person in relatively good health, and suddenly you see, wow, I don't want to pay $400 a month, or if you're a family plan, sometimes $800 a month or even more, only about 1 out of 5 people choose to do it. And it's almost exclusively people who know their costs are going to exceed their premiums, which is simple arithmetic. We would all do the same thing. Whereas if you're a young and healthy person, you wouldn't want to spend $300 or $400 a month on something you're not going to use. So this is what it looks like. This is just how normal people operate in the real world. You're not going to pay a lot of money for something you're not going to use. And so the study that came out is the first real, it's not just opinion, it's real facts of people that have purchased the coverage. It's extremely bad pool, and it just goes to show this thing's on a crash course that'll happen sooner rather than later. So the policies in the exchanges, you know, are guaranteed issue, which you can buy coverage whenever you want. So this is similar to being able to buy flood insurance after your house washes away, or buy car insurance after your car is stolen. You know, who would buy in advance if you know you can buy it after the fact? Well, that's how this health insurance is, how you can purchase it, and explains why people who are using it tend to be much sicker and younger people aren't buying it. So this isn't some new experiment. This will frustrate you because you'll hear this and say, wasn't anyone in Washington talking about this? A few people, but not enough and not loudly enough apparently. Guaranteed issue was tried in a bunch of states in the 1990s. In Kentucky was one example. They lost over 90% of their insurers in 5 years. The number of people without coverage in the individual market went up, not down. Policies went up 100% in some of the more extreme cases, but dramatically up everywhere. South Dakota, Washington State, New Hampshire, they all tried this. All of them repealed it a couple years later. So instantly you get the bad risks and the pool just falls apart. It's like selling auto insurance when you can buy after your car's stolen. How long do you think that company's going to stay in business? Not very long. So this is what we're seeing, except we're talking about millions of people now. New York and New Jersey kept their guaranteed issue to this day, and as a result, they have health insurance premiums that are hundreds, or some cases thousands of dollars a month if you have to buy for whatever reason outside of an employer, which is what I happen to do. Fortunately, it's not as bad in Virginia where I live. In health insurance speak, that's called a death spiral, where you only have more and more people with more and more costs, premiums go up and up and up, and we're going to see that in a few months because the 2015 premiums will be announced here. They'll start leaking out maybe come summertime, certainly before the election, which is good, but keep an eye on exactly how much more they're going to go up. So what will Obama people say? What will supporters of this law say? And how can you counter them? Well, the first thing they'll say is, well, yes, guaranteed issue is a bad thing, and yes, it does have some perverse incentives, but we have this thing called the individual mandate, which you may have heard of, where it's okay, if everyone is forced to buy, then we won't have the pooling problem. We won't get just bad risks and people that are healthy will stay out. If everyone's forced to buy, well, the premium, the penalty the first year is $95. That's not going to deter too many people. If the alternative is to pay thousands of dollars that you don't have, or $95, of course you're going to pay the $95. I mean, I think of myself, and there's probably a lot of people in this room, but when I was in my 20s, I was out without health insurance for a number of years. I mean, maybe it was dumb, perhaps, but I was perfectly fine, and the odds are strongly on my side, and luckily I avoided catastrophe, but probably a lot of you or your sons or granddaughters have gone without insurance. It's not recommended, but the odds are in your favor that you're probably going to be okay and not encounter a really catastrophic injury or illness. So they'll say the individual mandate will make a difference. Everyone will buy, so you won't have this problem. Well, that's if you believe that a 28-year-old male is going to spend hundreds of dollars a month on a policy he's not going to use. I mean, if you know people like that, they're extremely irresponsible and probably pretty wealthy, and probably not that many of them. They'll say, well, yeah, okay, the sick bought first, but don't worry, all the healthy people are buying now. This last rush of people that came in March, and as they extended the deadline into April, don't worry, they're healthy, they'll be fine, they're going to make the pool better. Well, again, that's if you believe. Let's just take a 28-year-old male in Des Moines who, let's say, after he pays his student loans, after he pays his rent, after he makes his car payment, let's say he has $600 a month left as disposable income for food and beer and girlfriends. You know, they're expensive. So if you had $600 a month in disposable income, do you really think they're going to spend $100 a month on a health insurance policy? I mean, you don't have to raise your hand or answer, but think to yourself, are they? Really? I mean, I'm speaking for myself because that was me. I specifically remember being offered health insurance for $50 a month when I was 23. And I calculated that was a whole month's of beer, $1 beer night at my favorite bar on a Wednesday. I mean, that's how 23-year-old males think. And the odds that they're going to spend $200 or more on policies that in many cases have $3,000, $5,000, or $10,000 deductibles, which a lot of people don't even understand what that is. That means the health insurance policy doesn't even pay anything until you've spent $3,000 or $5,000. They're awful, awful, awful plans. And so they're just not going to do it. And then this is the best part. So maybe some of you have heard about this, and it's a little wonky and a little in the weeds, but it's priceless. You have to hear about this. So there's a piece of the law called risk corridors. Some people call it insurance company bailout. That's a fair enough characterization. So what it does is if Blue Cross or Cigna or pick your health insurance policy, if they get a lot of people with really high costs, they actually get a bailout from taxpayers. So think about this. You're sitting there writing the bill. You're a Democrat staffer, a Democrat legislator, and probably a health insurance lobbyist. You're so confident this bill is going to fail, you build in a bailout. I mean, this is like proof that they knew it was going to fail, that they had to build this in. If you're building in bailouts in advance, you're basically, okay guys, I know out when we're in public and on the news media, we got to cheer and say this thing's great, but we all know amongst our friends this thing's going to be a mess and it's going to fail. So we got to make sure we build in taxpayer bailouts in advance. So the fact that even exists just shows that even supporters knew this thing was going to fail. So qualified health plans are what you buy on the exchange. A couple of the Democrats running for U.S. Senate are running for re-election. Mary Landrieu from Louisiana, Mark Warner from Virginia, where I live. We have a big race this year. One of their solutions, because those of you especially running for U.S. Senate, perhaps we have some nominee in this room, the Democrats may come up and say things like, well, we like Obamacare, but if we just tweak it a little bit, it'll be fine. So one of the ideas for a tweak that maybe you've heard, the plans are ranked gold, silver, and bronze. That basically explains how expensive they are and how much they cover. Their idea is to create an even worse plan called a copper plan. I'm not making this up. Like if you're trying to parody this is what it would look like. So the copper plans only cover 50% of costs, and in some cases have a $10,000 deductible. So they think, oh, well, it'll be cheap. It'll be $75 a month or $40 a month or whatever. But it'll have a $10,000 deductible. It's just crazy. Nobody is going to buy this stuff. And I would just ask you to use your own common sense. If you think people are going to buy it, that's okay. That's just a legitimate disagreement. You and I, you can disagree. That's okay. But if you know those people in their 20s or 30s are going to buy a product like this, I don't know them. Maybe you do. I don't. The other way they try and make these plans even somewhat affordable is have very narrow networks of doctors and hospitals. So probably some of you are starting to hear about this. People who have, this is going to be a rolling understanding. So even if people don't get it now, they will get it in 2 months or 6 months or in a year. Suddenly they'll find out their doctor, who they always went to, isn't covered. Or they'll find out a hospital when they show up in an emergency room, oh, that wasn't in the network. In California, I saw this morning. In California is particularly, I'm originally from there, they're particularly proud they have 1.3 million enrollees or whatever they claim. And all the good hospitals are not included in the plans, for the record. Cedars-Sinai, all the famous ones, of course, the movie stars go to, none of them are covered. And so just this morning, there was this report came out that 1,000 doctors in the States were listed accidentally as being part of the Obamacare network. Oh, they weren't, sorry. So all these people bought plans thinking, oh, my doctor's in it, good. Oh, sorry, no, not him. Sorry, that was our mistake. And of course, they released this information right after the deadline. That's convenient. So the new term, which is great, medical homelessness. So it's people who buy a plan and then they find out that no doctors see them. So that's great. Not only do you have the deductible of $5,000 or $10,000, the doctor you want to go to doesn't even take your plan, or the hospital you want to go to doesn't even take a plan. So there's a woman named Julie Boonstra. Maybe some of you have heard of her. If you haven't, I would strongly encourage you to go on YouTube and look this up. She's a woman in Michigan who has cancer and discovered when she bought an Obamacare plan that her physician, her treatments that she'd been using wasn't covered. So she cut this really brief ad. It's 30 seconds, 50 or 30 or 50, 60-second ad. Really very good. Just a relatively non-political woman saying I had these horrible plans, and it's very moving. It's hard to watch it and not get really angry or at least very emotional because it really hits at the problem. This is a woman with cancer, kicked out of her plan that she liked last fall, and can't get a plan that covers her position. So the Democrats in Michigan have sued the company. I think one of the super PACs was supporting the ad, trying everything to get this off the air. The tactics they've been using are just really, really atrocious. And she's been hanging it. She's attacked by those left-wing bloggers as a liar and a fake. I mean, it's bad enough Harry Reid, the Senate Majority Leader, says these are all lies made up of whole cloth. He'd be talking about her. You decide who you think is more believable, but her story is particularly. But that's where it matters. People don't care about billions of dollars or trillions of dollars. They care about $50. They care about $100. They care about $500 because that's how much really makes a difference in people's lives. So real quick, this is my last slide, and then I can happily take questions. So if you don't end up in one of these awful plans, you get to go in the Medicaid program, which is not a plan you'd ever want to be in. We always thought it would be fun to require all members of Congress to be in Medicaid because then they'd reform it really quickly, but none of them, of course, ever want to do that. Up to 100 million people could be on Medicaid when this thing is fully phased in a few years down the road. Without getting into the details, the way Medicaid is structured, it just encourages fraud, waste, and abuse. My former boss back in 2010, Newt Gingrich, had an op-ed with the CEO of AARP, of all organizations, where the two of them together agreed that there's 100 billion, with a B, 100 billion in fraud and abuse in Medicare and Medicaid every single year. 100 billion in fraud and abuse. So it's a massive problem. It's not talked about enough. Medicaid, some of you are decent at arithmetic. I do this because math was too hard in school, but this isn't that hard a calculation. Since 1969, when Medicaid really started to get phased in, the federal spending on Medicaid has gone up over 10% every single year for the last 45 years. So if your 401k went up 10% a year for 40 years,
Thank you very much. You said, sir, that the fine was $95 now if you don't have insurance. My question is that every time you go to the doctor without insurance, or is that a one-time fine for a year if you have a family? How does that work? I'm just curious.
Well, that $95, that's the first full year fine. So when you're filing your taxes in April of 2015, your annual fine would be $95.
Okay. So you go to the doctor like 5 or 6 times?
It has nothing to do with how many times you go to the doctor. But it also says $95 relative to perhaps hundreds of dollars a month for a policy. $95 fine isn't really going to deter you from, well, I better spend $200 a month, otherwise I'll have a $95 fine next year. most people, I'll maybe pay that fine later. So, yes, sir.
Thank you very much.
Clarification. Okay, first I'm Dave Mraz of Urbandale 2. Clarification, that's $95 or for this year, 1% of your annual income.
That's correct.
Whichever is higher.
That's correct.
So it's $95 if you're a welfare recipient. It's 1% if you actually have a job.
That's correct. And it gets phased in about 3 years, and it goes up to $700, or it can be more than up to 2% of your income. It goes up from there. But again, even that, relative to paying hundreds of dollars a month for a policy, is probably not enough of a deterrent. You know, Michelle Obama called young people knuckleheads. I think that was actually one of my bullets. Young people are knuckleheads if they don't buy these policies. Well, I was a little bit personally offended because I remember that was me when I was 23, 24. And yeah, 23, 24-year-old males do plenty of dumb things, maybe mostly dumb things, but most of them are capable of fourth grade arithmetic. Barely, but they are. And so if you have a $95 fine for an entire year, or $200 a month for a plan with a $5,000 deductible, they're just not going to buy it. Yes, ma'am.
There's one figure that I have not heard coming up.
I'll repeat your question if not everyone can hear it. Go ahead.
In 2010, we had a census. What percentage of those people in America is 8%? Is 8 million?
Oh, what percentage is 8 million? Well, it's about 300 million people, so that's like not even 3%.
Oh, well, some people were talking the other day, and they thought because he said 8 million, they meant 8% of the possible people. And it makes a lot of difference. And in 3% of the people in Iowa would barely be a ripple.
Right. Right. Yeah, 3%. It's 8 million is about 2.7% or something like that. The country does not very many. And you might have seen this too. Just about a week ago, they decided they're going to change the way they ask a question on the annual census form to make it appear that more people are covered next year. So they're just going all out on this stuff to just create a false impression. Yes, sir.
Is there anything that might be called a Republican alternative to all of this changing up?
Yes. In fact, that's a really good question. What's a Republican alternative? The media loves to say Republicans have no ideas. The fact is Republicans have too many ideas, and they can't get on the same page. And it's an issue that I think candidates have to address, that the U.S. House is looking to come out with a plan. The Senate, Senator Burr from North Carolina, Senator Coburn from Oklahoma, and Senator Braza from Wyoming have a good plan. That's the leading one in Congress right now. But Republicans have a lot of good ideas. Probably don't have, maybe I'll come back another time and talk through those. I'm happy to do it, because that's actually a lot of what we do. There's a lot of health plans out there that have been out there for a long time that actually work really well. People with health savings accounts. I've had a health savings account since 2005. I would never force anyone else what I like, but it works for me. It's a fantastic plan. My health insurance has a $2,500 deductible, but I only pay $130 a month. But over the last 9 years, I've been able to save up a lot of money in my HSA, and I ask how much this costs if I go to a doctor and get a prescription, which is what needs to happen everywhere. So, we have time for two more quick questions? Yes, ma'am?
Are you able to address the issue of, it's my understanding that when a patient shows up to the doctor with what is Obamacare time, the doctor has no way of knowing if that patient has kept current with their premium payment.
That's correct.
And that he also, or she, would also drive for 90 days. So I just wonder how long these positions are going to be.
Yeah, that's a very, very good point. Her question was, if you show up to a doctor, the doctor doesn't know if the card you're presenting means you're an actual active enrollment, have paid your last 3 months' premiums. And a lot of the medical community is very nervous about that. In January, they had a 2-week grace window where a lot of the physicians in Congress they said they were terrified because these people claimed they're enrolled. They were fooling around on a website. They show up the next day at the doctor's office for in some cases, high-dollar events, and the doctor has no idea if they're covered or not. And so the doctor performs the service, spends the time, spends the money, and then it turns out 2 weeks later they never made a premium payment, and in some cases never will. because they just needed one particular ailment. So there's significant gaming of the system, and it's a big problem, and doctors are very nervous about it, and rightly so. That's a very good point. I'm glad you brought that up. Yes, sir. There's two of you. If you can ask them both quick, we can both ask them.
Okay, my name is Raymond Starks. I'm from Moines Authority. This is going to be kind of a wonky question. I'm a quantitative economics major. I was talking to the professor.
Quantitative economics. I didn't major in that.
Yeah.
Talk slow, please.
Okay, well, since the Supreme Court has ruled the penalty of not having insurance and tax, I was wondering, do you know what the tax has to be to incentivize switching over to either the voters plan?
The question was, how high would the tax have to be to incentivize people buying the plan?
Correct.
And the answer is, I don't think it could be high enough. I mean, assuming they're even going to enforce it in a significant way anyway. I mean, Congress at the very least was able to deny the 15,000 extra IRS agents. But especially for younger people, you know, it's amazing how many people don't even know about this. Don't even know. I mean, most of us are a little bit more active. Half the country doesn't know anything about this at all. And the idea that they're going to run out and buy coverage because they heard there's a fine or whatever, and some celebrity they follow tweeted about it, you know, they're not going to go out and buy it. So it's a great question. I see what you're asking, but
Back up a little bit because you're getting some feedback.
oh, okay. It's a great question, and it's hard to know there's no exact way to know what the answer is, but for a lot of people, it doesn't matter how high the fine is. They're just not going to pay it. Like, a lot of people don't file income taxes too. In fact, the number of people actually filing has gone way down in the last 5 years, which is a pretty bad thing to begin with. But for a lot of people, it just doesn't matter. It's as high as they make it. The higher they make it in some cases, the less likely people are to be incentivized. Well, I just can't pay that. And if the alternative is a plan that costs hundreds of dollars a month, which again, you always got to think of people with $500 or $600 a month in disposable income. That's a pretty normal range for normal people. And spending $100, which may not sound like a lot, but it is for a lot of people, that's just, people don't have that kind of money, especially when they figure out how bad the plans are and when they figure out that their doctor in the hospital isn't covered. Yes, sir?
My question is along the same lines, and that has to do with the penalty, the $95 or the 1%. Is there any mechanism in place that will keep that at some threshold, or is there any reason to believe that they can't change that to 4% or 5%?
In theory, they could, sure. And yeah.
At some point,
The question was, can they make the penalty more in future years in order to? But I mean, the penalty does top out in 2016 or 2017 tax filing. So there is an eventual cap on it 3 years down the road, so it's higher than it is now.
what is that cap?
It's $695 for a low income, or 2% of your income, and so that's where it stops. But again, that's a paltry amount compared to what a policy might be, especially a bad policy that's really expensive. So the whole theory of this thing working depends on lots of young, healthy people buying coverage. So the White House, you probably just saw the other day, they said, 28% of people are between ages of 18 and 34. Well, they need 40. But what they don't tell you, and this is what the Express Scripts study starts to hint at, is I guarantee that the people, even if they're 18 to 34 that are buying, are sicker than your average 18 to 34-year-old. It's absolutely true, because that's just normal human behavior.
Jim, last question over here.
Oh, yes, ma'am.
Did they really force us on the individual mandate to have Obamacare?
The question is,
And was that legislated from the bench that we do have to have it?
The question was, can they really force us to buy this? They can force the penalty, the tax, and people can or can't pay it. And then the Supreme Court, John Roberts was the swing vote. He was the one that decided in June of 2012, that surprisingly to a lot of people, including me, he was the swing vote that said it's a tax. So it wasn't the Commerce Clause, it was the Taxation Clause, which wasn't even what the government had argued. He kind of gave them that, just I'm not sure why.
This is the last question. Can we get rid of it?
Yeah.
Is it possible to,
I tell you, I'm originally from California. All I can do is apologize for the senators we send. There's nothing we can do about that, but Iowa actually has a chance to do something good. I mean, it's really, I mean, if Iowa sends a Republican to the Senate, that probably means we pick up 8 or 9 or 10 U.S. Senate seats. That's about the threshold. That's where it kind of ranks. So if we put one of the candidates here in, that means we definitely got control, and it means we probably picked up, I would say, at least 8 or 9 seats. So please, on behalf of those of us who are guilty of not sending good representatives, help us. Thank you so much.
If they would just-